If you're struggling with pain in your lower back or some stiffness in your lower back and you want to do the right exercises, then stay tuned, this is the right video for you. So how would you know if your low back pain is actually caused by some wear and tear? In all fairness, to be absolutely sure, you probably would need an X-ray or an MRI scan or something to confirm, but there are some telltale signs. First of all, you are of a particular age. Wear and tear happens not that much in young people, unless they've had trauma, but more in the elderly population. Secondly, you have a pain, a deep, dull pain, which is located in the lower back, and it can even radiate down your buttocks or the back of your legs. That's another thing. There's also stiffness involved, especially first thing in the morning. So when you're getting out of bed stiff, you need some time just to get yourself supple again, or when you've been sitting down in a chair for some time and then getting up, there's some stiffness there. That's also a telltale sign of wear and tear. You can get some muscle spasms, especially in the low back and the buttock area. That's also a sign of wear and tear. And the other thing is often it improves with movement. So whether you go for a bit of a walk or cycling, it improves. So I'm going to give you 5 things you can do to help yourself if your back pain is caused by wear and tear. So when you're struggling with back pain and stiffness caused by wear and tear, what are you going to use? Are you going to use ice or are you going to use heat? I'll tell you what we're going to do. We're going to use them both. It's called contrast therapy. And contrast therapy provides the best balanced mix between ice and heat, which helps with reducing the pain and reducing the stiffness as well. Reason being is what cold does is cold restricts the diameter of the blood vessels, thereby reducing the inflammation and the swelling of the tissue, but also it acts as a local anesthetic. But heat, on the other hand, dilates the blood vessels so they become bigger, and we need that for all the nutrients and the oxygen to go to the area, the damaged area, to help and repair it. And what heat does, it helps with the local tension in the muscles as well. Now with contrast therapy, what you're essentially doing is you're creating a pumping action where we're pumping nutrients into the area and we're taking it away. So it's a perfect environment for tissue healing. Now with heat, you have to be careful if you are suffering from diabetes, if you have some vascular pathologies, or if you've had a deep vein thrombosis. So your contrast therapy is used as a ratio with 1/3, which means you do 1 minute of ice and then you do 3 minutes of heat. We're going to do 3 cycles in total. So 1 minute ice, 3 minutes heat, 1 ice, 3 heat, 1 ice, 3 heat. But we always end with ice. What I recommend you do is you get yourself a couple of these gel packs, these cold packs, which you can put in the freezer or in the microwave. Make sure you can do them both. Wrap these things up in a tea towel, so don't apply this just on the bare skin. Best is to do it on a tea towel to protect your back a little bit. So this is my heat pack. Put it on there, and then what you do, best way is to just lay on your back. So lay on your back and apply the ice where you feel the pain in your lower back. Yeah, and you lay on this, just simple, for a minute. Keep your knees bent. That's the best position for your back. It's the most relaxed position for your back. Now, if you can't do this, you're okay to do this in a chair, sitting up. If you can't lay down, absolutely fine. So hold this for 1 minute. After 1 minute, you take your cold pack out. You get your hot pack, put your warm pack in your lower back. There you are. And you lay in this for 3 minutes. And as I said, you do three sets. 1, 3, 1, 3, 1, 3, and it's important to always end with ice. So the last section is a 1 minute of ice, and this is essentially your contrast therapy, really effective dealing with pain and stiffness which is caused by wear and tear in the lower back. So these next set of exercises I'm going to demonstrate to you are safe, effective and easy to do when you're struggling with back pain caused by some wear and tear. Now what I'm going to do and the way I'm going to demonstrate this is I'm going to be on my hands and knees and on my back. If you're struggling to either lay on your back and then getting out of bed, or you can't get on your hands and knees because you've got some wear and tear perhaps in your wrists or your knees, I'm also going to demonstrate the same exercises you can do standing up, so it's a bit easy for you. The first exercise I'm going to demonstrate, which is really effective, is the cat-camel exercise. Super simple. What you need to do is support yourself on your hands and your knees. You see my hands are roughly underneath my shoulders and my knees are roughly underneath my hips. Yeah? And all you do now is you do a cat and a camel. So we've got the camel making the hump, and you hold this for a second, and you push out as far as you possibly can, and also push out with your arms. So you're really bending your whole back, chin on your chest, And then once you've had this for 10 seconds, you do a catch. So you come all the way back and you really drop your belly button and you look up as much as you can and you hold this for a few seconds, 5 to 10 seconds, and do the same thing again. So you push yourself all the way up. Make sure you push yourself through your shoulders as well, and then really push your area between your shoulder blades, push it up, and then you go the other way and you tilt your head backwards and you really push your belly button as far down as you possibly can. So this is a cat camel, so I would say you do about 10-15 repetitions, hold each for about 10 seconds each position. So a safe exercise to do, and you get some movement in the lower back. Now if this goes well, we can move on to the next exercise. Very simple again, we just lay on the backs. Lay on the back, and all we do now is we put both our knees to our chest and we hold this again for about 10 seconds, yeah, and we put them down again. Or if this is too much, you can do one knee at the same time, one knee at the time. So you pull one knee and you pull the other knee. I mean, both knees will be best if you can. So put both your knees towards your chest as far as you can. Yeah, that's the first exercise. Again, 10 repetitions, and you hold each stretch for about 10 seconds. And the second one, what you do is you just very simple go with your knees side to side. So to the left, hold this for 10 seconds, and to the right. And these are fantastic exercises for mobility in the lower back. It really targets your lower back if you're struggling with a bit of wear and tear in your lower back. Simple exercise to do. Yeah, so you just go left and right and side to side. Simple exercises to get yourself some mobility in that lower back, and that will definitely help you with your pain and stiffness you experience from wear and tear. So let me continue now to the standing up version of this. So if you're struggling to go on your hands and knees or to lay on your back, you're struggling to get out of bed or from the floor, these are exercises you can do standing up if you're struggling with a bit of wear and tear. Super simple. First thing is you just bend forwards. You bend forwards, you can support yourself on your upper legs and bend forwards and really try to push yourself, push your back all the way as back far as you possibly can. So you're really going, bending your back as far as you possibly can. You hold this for about 10 seconds, and that goes well. What you do is you put your fists in the small of your back and you push yourself that way. You push your pelvis forwards as far as you can. Again, hold this for 10 seconds. This is generally a good exercise, not just wear and tear, but generally this is a very good exercise to do. Yeah, and you do the same thing. You hold 10 seconds and you repeat it 10 times each side. That's the first one you can do. The second one, simple, take a wide stance. Yeah, about 30 centimeters, about 15 inches space between my feet. And all I do now is I slide my right hand down the outside of my right leg. Hold this again for 10 to 15 seconds, and you go the other side. Same thing here, 10 to 15 seconds. Yeah, so that resembles your leg side to side a bit. There you are. So do that. And what you can do, the other thing you can do is again, move your feet to the side, make sure you got wide stance, grab on to your elbows, and all you do now is just go to the side, one side, and you go to the other side, and again, hold this for about 10 to 15 seconds each side. So it's a simple exercises you can do just to get yourself a bit of movement and mobility in the lower back if it is getting a bit stiff, and it's safe as well. So this next exercise is also very effective and a great exercise to help you with if you're struggling with some wear and tear in your lower back. And we're going to apply some self-traction. So we're releasing the pressure of your lower back. Now I'm going to use 2 sturdy chairs to do this. You could also, maybe you can find something to hang from that would give you the same effect. Maybe you can use the banisters of your steps, of your stairs, that'd be the same effect. But it's very simple. What you do is you place your hands obviously on the back of the chairs. They are sturdy, make sure they are sturdy. And all you do now is you transfer the pressure from your legs to your arms, and essentially you're tractioning the spine and you're giving some relief to the spine, and you hold this for as long as you can. Maybe you can do 20 seconds, maybe you can do 30 seconds. Obviously depends a little bit on the strength in your arms, but you do this for about 20-30 seconds, and you repeat this 3 to 5 times, and that will give you definitely a bit of relief from your stiffness and the pain in your lower back if it's caused by wear and tear. It's also a good exercise to do if you're struggling from a slipped disc. But also from wear and tear. This is generally a great exercise to do. A little bit of self-traction. If you have a yoga ball, you could roll over the yoga ball, lie over the yoga ball, facing forwards. That will also give you nice traction. That's another thing you can do. But this is a good exercise too, so a bit of self-traction. So when you're struggling with wear and tear, you're also going to have some muscle knots in muscles surrounding your lower back. So often it'd be in your buttocks area, or the top of your buttocks area, or a little bit lower, and in your lower back itself. So here's some techniques I'm going to demonstrate to you. You can help to get rid of those knots in those muscles. First technique, you need a tennis ball for that. Simple, is you go close to the wall, you place your heels on the wall, your feet on the wall, lift your pelvis up, place the ball roughly on your glutes, on this area here, maybe just a little bit over the bony bit there, and then all you do now is you roll and you self-massage that area, top of your glutes, where you can feel that pain. So that's a very good technique to get rid of some muscle knots. You massage it for about 5 minutes, and the beauty is by keeping your feet on the wall, you can actually adjust pressure and put more or less pressure on. And when your feet are on the floor, it's hard to adjust the pressure. So this is a very good technique to do this. So that's for your glute area. You can do obviously both sides. And then for your lower back, what you need to do is get yourself a long sock. You can see I've already got a ball in here. All I'm going to do now is place the other ball in here as well. Get it all the way down. Get them close together. When they're close together, I'm going to make a knot in here, tie it all up so the balls can't essentially move. And now what I have is I've got like a self-mobilizing device or a muscle massage device for the area on the lower back. So my spine sits in the middle and these balls roll on my muscles on the side. So the same thing here. So close to the wall again, up here, and I place the balls in my lower back where they are exactly. And what I can do now is I can roll up and down, or I can add some pressure, roll up and down, and with this rolling movement as well, you can get a really lovely self-massage on those muscles. You're really going to feel that literally where those muscles attach to your pelvis. It's a great exercise to reduce some tensions in the muscle of your lower back where you're struggling with a bit of pain and stiffness due to a bit of wear and tear. So a very good tool you can make at home, simple as, very, very effective as well. I hope you've enjoyed this video. If you thought it was valuable, would you mind just subscribing to my channel, or give me a thumbs up, or leave a comment in the box down below. Feel free to forward this video if you have friends or family who might benefit from the information I shared in this video. For now, I'd like to say take care of yourself, take care of someone else please as well if you can, and bye for now. Bye bye.